Welcome to the screencast, Signs and Symptoms of Renal Failure. An initial sign of acute renal failure is oliguria, where the patient will pass less than 400 ml in 24 hours of urine, or anuria, where less than 100 ml of urine is passed in a 24-hour period, and will then result in a positive fluid balance. This will be evident in a raised CVP, indicating an increased preload and that the patient is fluid overloaded. The increased preload increases the heart workload, decreasing the heart's efficiency and reducing cardiac output. Due to an increase in volume of fluid in the vascular system, hydrostatic pressure is increased, forcing fluid into the interstitial spaces and contributing to peripheral and pulmonary edema. The inability to create urine and filter blood effectively results in an accumulation of potassium, which is significant in cardiac function, resulting in ECG changes. Due to an increase in fluid volume in the vascular system, hypertension may be evident. Hypotension activates the renin-angiotensin-aldosterone system, which increases sodium and water reabsorption, further increasing circulating fluid volume, an example of a negative feedback system. Potassium accumulates within the body. If levels reach greater than 6.5 millimoles, it is considered a medical emergency and immediate action is necessary. There is also an accumulation of nitrogenous waste, urea and creatinine due to a reduced glomerular filtration rate. In acute renal failure, hydrogen ion excretion is compromised, resulting in metabolic acidosis. The body's buffering systems for acidosis, cerium bicarbonate, is utilised to try and establish an acid-base balance. However, consumption is greater than production and is evident on arterial blood gas results, increasing negative base excess and decreasing bicarbonate levels. As well as renal excretion of hydrogen ions, they can also be excreted via the lungs. An increased concentration will stimulate an increased respiratory rate to breathe off hydrogen, and therefore hyperventilation. As already explained, pulmonary edema is present in acute renal failure, reducing effective gas exchange, reducing oxygen uptake, decreasing partial pressure of oxygen, saturations and increasing shortness of breath. Ineffective gas exchange inhibits exploration of carbon dioxide and therefore hydrogen ions, exacerbating the acidosis. The effect of inadequate gas exchange increases risk of hypoxia on a cellular level and is detrimental effects of the acute renal failure. Please answer the following questions.